Hello, I'm Dr. Sowmya, Senior Consultant Neurologist at Aster RV Hospital, JP Nagar, Bangalore. Now I'll be talking about the lifestyle modifications which are necessary in the treatment of migraine. So before we go to the medications, we always discuss with our patients about, what are their triggers and what are their usual lifestyle habits. There are various triggers for migraine. The common ones are, sleep disturbances, skipping meals, delaying the meals, fasting, and then exposure to sunlight, exposure to strong sounds and smells, and mental and physical stressors. Sometimes it can be excessive coffee intake, alcohol, smoking. So there are there may be something in the diet which may be triggering. So each person has their own triggers. So we need to identify those, and avoidance is key. So this is a trigger for migraine that has to be avoided. When it comes to lifestyle modification, again, because migraine is going to be a chronic disease, and you cannot go on taking medications for it. So always it's better to incorporate these lifestyle modifications. So the first thing is about sleep. So make sure that you have regular sleep habits, you have a good sleep hygiene. Minimum of 6 to 8 hours of sleep is essential. The second thing is about diet. So avoid the triggers in your diet, and ideally have meals at regular intervals. Avoid delaying your meals. That's very important. The third thing is about physical activity. So obesity again, increases the incidence for migraine. So it's better to, reduce weight if you have tendency for obesity, and, a regular physical activity, exercise goes a long way. Other things which we discussed about is the other lifestyle modifications, like avoiding smoking and excessive alcohol intake. Now, excessive caffeine consumption is also an important trigger, so that has to be moderated as well. Now, apart from this, your other health issues, if you have diabetes, if you have hypertension, cardiac issues, medication, so all these things again need to be modulated. So when it comes to lifestyle modifications, it's going to be a balance between your diet, your sleep, and another important thing is about stress, mental stressors. So I think a lot of us go through a lot of physical and mental stress these days, and it's something which we cannot avoid. But what we usually advise is learn how to manage your stress, right? So if you can learn that skill, I think that goes a long way. And it not only for migraine, I think you can have a control over various ailments which can be triggered by stress. Simple things which can be included in your daily lifestyle is relaxation techniques, meditation, yoga. So, each person has their own different ways of doing this. So, I think to conclude, to summarize, I would say that, avoid triggers, identify your triggers and avoid them, and have a good, lifestyle routine, a disciplined lifestyle routine. By doing this, you can prevent or significantly reduce your incidence of migraine headaches. At Aster RV Hospital, at the Department of Neurology, we do have services not only for migraine but various other headaches and other ailments. And please recognize your triggers for migraine, recognize that you have these issues, and please feel to consult us here. Thank you.